Okay. Hi, everyone, and welcome to the Social Skills Training for Parents. Thank you for tuning in. Today, we're going to be talking about emotion recognition and regulation. And for this session, we're going to be doing 30 minutes of presentation and then 15 minutes of question and answer. So we are on our 5th week of the Social Skills Summer Series. And next week, we're going to be talking about disclosing diagnosis and sibling support. So if you're interested in that, then you can just make sure to tune in. And as I mentioned, today we're going to be speaking about emotion recognition. Then we're going to move on to emotion regulation. And then we're going to have time for question and answers and discussion if you'd like to join in. And before we get started, we can do some introductions. So my name is Celia. I have been a volunteer in ASAC Social Skills Group, and I'm an incoming doctoral student.
Okay. And I'm Deepika. I am a 5th year doctoral student at FIU doing my practicum at ASAC this year.
I'm Dr. Amy Beaumont. I am the director of the Autism Spectrum Assessment Clinic. Thanks for being here.
Thank you. Okay, so with everything that's going on at the moment, as we prepare for the upcoming school year, we're all experiencing strong emotions. And before we get started with today's session, it's important to recognize that all emotions are normal, they're natural, and they're harmless. So emotions play a very important role in our lives. They motivate us to take action and influence our decision making. So they're always telling us something. So with that said, emotions are not necessarily good or bad. So for example, being angry, sometimes it's normal, and what matters is what we do to express that anger and manage that anger. So in today's session, we're going to be talking about ways we can help children better recognize their emotions in themselves and in others, and also teach them how to manage these strong emotions appropriately. So talking about our feelings and understanding other people's emotions can be challenging for many of others, but this is especially difficult for children on the spectrum. So in today's session, we're going to be learning about emotion regulation and recognition. And so how can we tell what someone else is feeling? So the way we can do this is by looking for signals. So whether that be nonverbal cues like facial expression, tone and body language, all that tells us a lot about how others are feeling. And also body signals such as breathing faster, your heart beating faster, your face turning red, your muscles are tense or upset stomach. So all these are signals that indicate how we may be feeling in the moment and can help us recognize our emotions. So this is just an activity that we do with the children during our in-person social skills group here at ASAC. And we basically encourage children to look for signals that may help them with emotion recognition. So we ask them to identify an emotion, and then for that emotion, they describe how it feels inside their body. So for example, when I'm angry, I might feel it in my heart. So because my heart beats faster, or maybe in my face because it feels hot, or my hands because they clench into fists. So this is just an example of many activities that you can do with your child to promote emotion recognition and have that conversation. Another activity that we do with the children is watching a cartoon or a movie with no sound and asking the children to try to think what the characters are feeling or what emotions or what's going on. And the way that they can tell this is by, body language and these nonverbal cues. And you can also play emotional charades with them. So with face masks now being an increasing part of our new normal, we now have to look for signals more carefully in order to read other people's emotions. So in this picture, this researcher is trying to show different facial expressions. But as you can see, when wearing a face mask, emotions can become even more difficult to distinguish. And because face masks, as you know, cover our nose and our mouth, they make the lower half of our face basically uninformative for the purpose of emotion recognition. So this makes it more important to look into the eyes of someone. And this is something that some people may have discomfort with, specifically children with autism. So there's many things you can help or things that you can do to help your child practice recognize emotions in others and in themselves while wearing masks. So you can do this by practicing emotional expressions with a mask in front of a mirror and directing them to pay attention to facial cues that can't be seen. Focus on body movements, hand gestures. You can also direct children to look at your eyebrows more. Try to look more into your eyes, more eye contact and gestures when you're talking about emotions. So for example, look, I'm happy right now. Even though you can't see my smile because I have a face mask, you can see that my cheeks are lifted up, my eyes crinkle a little bit. So, just trying to look at those signals. And you can also increase the use of gestures throughout the day when talking about emotions. So for example, you shrug your shoulders when you're sad, you put your arms out when you're happy. And then another tip we suggest is that you can also allow your child to use masks during play with stuffed animals. And this is just to help them, familiarize them with seeing masks in their environment. And we're also going to be talking about emotion regulation in today's session. So in our everyday lives, we have moments when we feel very angry, sad, scared, nervous. This is all very normal. But it's really important to have strategies to use to help us feel better when dealing with these very strong emotions. So this is the 5-point scale, and this is something we introduced in our Kit Club at ASAC. So the 5-point scale, basically, it allows us to rate our feelings and to communicate to others how we're feeling. So at each level, your child is going to identify what each rating might look like, what it might feel like, and possible solutions to control them. So when you use the 5-point scale, you should first prioritize emotion that will be targeted. So you'll have a scale for each different emotion. So for example, whether that be anxiety or anger, and you should work with your child to develop the skill and also identify possible replacement or coping skills. So in the scale of 1, so down there, the green, so that would be, you're fine, you're not bothered at all. A 2 is when you start getting bugged by something, so you start feeling a little bit uncomfortable. And then a 3 is something that makes you nervous. 4, you get, something that really upsets you. And then 5 is when you feel that you totally are losing control. So you should first introduce this when your child is calm, and then have the skill available for your child to refer at all times. So it might be a good idea to print one out so he or she can have in his pocket or backpack, and then maybe just hang one on the fridge, somewhere that they have accessible. And again, as I mentioned before, it's important to keep in mind that all emotions are normal. So by rating them as numbers, they're not necessarily good or bad. So again, being angry, it's something that's normal. But when we feel these emotions very strongly, we have to make sure that, first of all, we recognize them. So that's when this skill comes handy. And we recognize them early enough where we can implement something, a coping skill, which is something that we're going to be talking later on about during today's session. So what really matters is how we manage these strong emotions. And helping your child identify when, oh, well, this is just an example. So we can just move on. And so yeah, helping your child identify their emotions when he or she needs to use a coping strategy is very helpful. But what's even more important is knowing how you can also help. So you should ask yourself when times to intervene in your child's emotional expression. Is it, when is it helpful? When is it hurtful? So not only do we suggest that you create a 5-point scale with your child and choose an emotion and create it with them, but also create one for yourself and a parent plan. So kind of like what you see in this slide. So, at 1, when they're feeling okay, they're calm, they're happy, use that time to praise them. When they're a little bit annoyed, when they're moving to a 2, maybe that's a good time to model something or, model moving on, offer a reward, explain your expectations. And then once they start getting to a 3, they're getting annoyed. Then again, explain to them their expectations, remind them of the reward, and then that's when you might want to start ignoring. And then again, that applies to the 4 and 5. So 4, you might want to introduce a visual cue, a brief verbal reminder to be flexible. And then it comes to a point that you might, start ignoring, especially in a 5 when they're kind of losing control.
Okay. So now we will move on to discussing emotion regulation strategies. So once your child is aware of and understands and recognizes that their emotion is high, then it's helpful to then teach them different types of strategies that they can do to sort of calm themselves down. We'll focus our discussion on identifying helpful versus unhelpful thoughts, helpful relaxation strategies, and also how to create a coping toolbox for your child. So the idea of identifying helpful versus unhelpful thoughts stems from the cognitive model of behavior, which you can see on the slide over here. So this model basically states that how we think affects how we feel and then how we act, and vice versa too. So that's why you can see that the arrows here go both ways. So as an example, let's say a child gets in trouble with his teacher for talking to another student in class. So his automatic thought in that situation might be something like, that's completely unfair. Why am I the only one who ever gets in trouble by the teacher? I hate my teacher, or something like that. And like we were discussing before, the emotion in response is valid, but the behavior that might be driven by that emotion might get him in more trouble. So if he has that thought and then gets angry and then subsequently is aggressive or talks back to the teacher or something like that, that could get him in more trouble. So that having that angry thought of I hate my teacher so much is an example of an unhelpful thought. So when something stressful happens, unhelpful thoughts make us feel worse. And so here's some examples of unhelpful thoughts that children might have in response to stressful situations. So things like, I hate myself, or I want to hit somebody, or I hate doing homework, or I hate my teacher, this is so unfair, things like that. And on the other hand, having a helpful thought can make us calm down, stay in control, and feel better. So in the example from before, if the child thought, if I keep my cool, I won't get in trouble, or I'm getting tense, I need to relax, that will then decrease the chances of him or her reacting negatively to the situation. And it can also help them feel better about the situation too. So as a parent, it can be helpful to try and talk to your child about unhelpful thoughts that he or she is having when he or she is feeling upset. And you can work together to come up with other thoughts or other things they can do to help them feel better. And so here are some examples of helpful thoughts that they can think about instead in those types of situations. So things like, I can handle this, it's time to take deep breaths, I'm getting tense, I need to relax, things like that. So in addition to changing the way we think, we can make changes to our body to feel more relaxed. So one helpful relaxation strategy is deep breathing. There is a right and a wrong way of taking deep breaths, so it's really helpful to make sure that your child understands the right way to do deep breathing before suggesting this. So the wrong way is if the child is taking really short, fast breaths, because that can cause hyperventilation and can also trigger some panicky symptoms, which we want to avoid. So instead, the right way of doing deep breathing is to take really slow, deep inhales through the nose, pausing for a second, and then a deep exhale through the mouth, as pictured here. And for younger children, it can be helpful to explain this concept through using different types of examples. So one thing that we recommend for younger kids is to do pizza breath. So if they really like pizza, we ask them to imagine that they have a really hot slice of pizza straight out of the oven, and it smells really good. So we ask them to smell the pizza, and then because it's really hot, they have to blow out of their mouth to cool it down. Another example is balloon breaths. So I've heard a couple of different ways of using balloon breaths. One is to pretend you're blowing a balloon. So to inhale through your nose and then blow out through your mouth as if you're making the balloon bigger and bigger. The other example that I've heard before is also the child pretending that their belly is the balloon to encourage diaphragmatic breathing, where they imagine they take the deep breath deep enough so that their stomach kind of blows up like a balloon. And then a third example could also be as if they're to pretend that they're blowing out birthday candles and that they have a lot of candles to blow out. So they have to take a really deep exhale to make sure that all of the candles are blown out. So those are just a few different types of examples, and you can sort of tailor your description to whatever you think your child would enjoy best. So another relaxation strategy that can be helpful is a visualization technique in which a child remembers a really relaxing or happy time or place. And this can be recalling a memory or just making one up, imagining one. And in order to make this as effective as possible, it's helpful to remember or imagine this event in as much detail as possible. And to do this, it'd be helpful to have them activate all 5 senses. So if in this picture, the child is remembering a time when they went on a beach vacation, it could be helpful to ask them, you know, what do they remember seeing? What did the ocean smell like? How did the sun and sand feel on their skin? What could they hear while they were on the beach? Some other examples that I came up with based on other kids that I've worked with is remembering a trip to Walt Disney World and remembering the rides they went on and the feeling after. Another child that I worked with really loved her puppy, and her visualization technique was to remember the day she got her puppy for the first time and the feeling that that elicited. And if children have a hard time with visualizing something or coming up with a memory, there are also relaxation scripts that are available online and free for kids. So if you just Google relaxation script for kids, there's a ton of different options in which, you know, they give you a script that you can read verbatim to help elicit this sort of visualization and relaxation. And then another relaxation strategy is muscle relaxation. So to relax the muscles, the child can either do some stretching or yoga or light exercise. There's also progressive muscle relaxation, which is where you tighten and tense the muscles and you start from the feet and then you slowly work yourself all the way up to the face. And then for younger kids, you can explain the idea of tightening and tensing your muscles by the example of the lemon squeeze. So with the lemon squeeze example, what you're telling them to do is pretend that they have 2 lemons in their hand and they need to make lemonade from the juice of the lemon. So they're asked to squeeze as hard as they can and get all of the juice out in order to squeeze their muscles and then eventually relax. So we talked about, you know, identifying helpful thoughts and different types of relaxation strategies, but coping strategies can really be anything that your child does to distract himself and take their mind off of whatever strong emotions they're experiencing. So to create a coping toolbox, it's helpful to create a list of activities that your child can do to calm down or increase their mood. And it's helpful in this list to incorporate some of the relaxation strategies that we talked about and also some of the helpful thoughts too. And so then by having this whole list of things that the child can do, you can have the child choose a few things that they feel like would be really helpful for them or things that have worked for them in the past, and then use those things for the toolbox that you then create. So in this example, the child chose these things to go into their coping toolbox. And then here is their coping toolbox. So when I'm mad, I can, and then they decided which ones they wanted to choose. And by having a coping card in this format like that, next time that they're at a 3 or higher on their 5-point scale, they can just take the card out and look at the different strategies that they can use to help calm themselves down. And this is an example of a template that you can use for the coping toolbox. And that's it.
We hope that you enjoyed our presentation.
Thank you.
Thank you.